Hello everybody, and today I'll be talking about a birth defect called cleft lip and or palate. Just a warning, the more severe cleft lip and or palate is a little gross looking, and if you're sensitive to the more gross looking pictures, then I suggest looking away, and I will warn you before I show any of the more severe cleft palate pictures. So, on to the video now. Cleft lip and or palate is a common birth condition where there's an opening or split in the roof of the mouth or the palate and or the lip. There's about fewer than 20,000 US cases per year. Babies can be born with either cleft lip or cleft palate, or they can be born with both. About 1 in 1,600 babies are born with cleft lip and palate. About 1 in 2,800 are born with just cleft lip, and about 1 in 1,700 are born with cleft palate. There's another type of cleft called submucous cleft palate, which is less common and occurs only in the muscles of the soft palate. So cleft palates happen early during pregnancy. So usually palates are formed during the 6th or 9th week of pregnancy, and clefts happen when the palate doesn't close all the way. Cleft palates can be diagnosed during pregnancy by ultrasound, but I believe it's usually diagnosed when the baby is born. The only exception to it being diagnosed at birth is the submucous cleft palate, which is unnoticed at birth but will be noticeable later in the baby's life. Some of the challenges babies with cleft palate will face is difficulty with feeding, speaking, and it's possible that food and liquids will come out their nose, and it's also possible for the baby to get chronic ear infections. In some cases, some children can deal with self-esteem issues due to their appearance. Despite all that, cleft palates can be cured through surgery, and surgery usually happens in the first few months of the baby's life. And with surgery, most children with clefts have a healthy life. Also, speech therapy can help correct speaking difficulties if needed. If the baby doesn't get surgery, the child will face significant disabilities or even death. There's no definite cause for cleft palate, but it's maybe caused by genetic and environmental factors and other risk factors such as family history, exposure to certain substances during pregnancy, having diabetes, or being obese during pregnancy. Mothers can help prevent cleft palates by considering genetic counseling, taking prenatal vitamins, and not using tobacco and alcohol. Overall, cleft palates are curable, and most kids live normal lives if they do get surgery. And that's all the facts I have about cleft palates. Sources will be linked down in the description. And that's all I have for today. Bye, guys.